Hello and welcome to the CAPE training program. My name is John Leatherman. CAPE is short for Community Assessment and Education to promote behavioral health planning and evaluation. This training and related activities was sponsored by the Substance Abuse and Mental Health Services Administration, the U.S. Department of Agriculture, and the USDA network of regional rural development centers. The objectives of the program are to enhance behavioral health literacy by offering the Mental Health First Aid Workshop with an emphasis on substance abuse. Our second objective is to motivate the creation of community coalitions to address local behavioral health needs, such as those related to the opioid epidemic. Finally, we are encouraging the notion of formal action planning to create a community roadmap for improving the local situation. In this video, we'll continue our discussion of assessing community preparedness by talking about the essential leadership that's required for undertaking a community-scale initiative. We'll also talk about the public relations of community engagement. There are at least 3 types of leadership required for a complex community project. They may be different people or they could be the same person. First, someone has to get the effort going. This requires doing homework about the issue to make a persuasive case for doing something and having an idea about what that something should be. This person has to have some legitimacy in advocating for the issue and have sufficient respect that people will take it seriously and listen. It helps to believe in the importance of the issue and convey some of that passion and belief. The person stepping up needs to put himself or herself forward and make a commitment to continue and contribute. Then there needs to be a visible public leader. Ideally, this person has a broad and encompassing view of the community needs and organizations. This person may be the real leader of the initiative or only symbolic. Both are needed, but if that's the same person, that's fine. It might be different individuals. That person should be suitably credentialed, that is, have the legitimacy to be leading a given effort. Ideally, this person is well respected and has a certain gravitas, so people will listen and be persuaded. This person should be reasonably accessible. Ideally, this person has the communication skills to be able to present ideas and make the case for something. Finally, the level of commitment one has for an issue is readily apparent to the people tracking the effort. The last type of leader needed might be called the facilitator. This person actually does the ongoing work. This person should be situated in a position that allows them to be involved in the issue. This person should have administrative blessing and freedom to dedicate time and energy to the initiative. It's helpful to have access to certain organizational resources, things like copying, mailing, telecommunications. Finally, and most important, this person has to be willing to make the initiative a priority among whatever their regular duties may be. When a person serving in this role treats the effort as a second thought, it shows, and the community effort will never achieve its potential. Now let's think about the partners that we need to have at the table. When we did our stakeholder analysis, we figured out what entities needed to be represented. Hopefully they will share the same concern. Ideally, these representatives will have been around long enough to know the community, the issues, and some history. They should be high enough in the organizational hierarchy to have some autonomy and be able to make some decisions. For example, our mental health coalition here in Riley County, we don't have the hospital CEO or the chief of police. We do have the director of the hospital emergency room and the police division captains in charge of the patrol and county jail. These are the types of leaders who can make a decision on the spot, rather than have to run and ask permission for everything. Finally, we would want people to come to the table with a sense of openness and cooperation, rather than turf protection. Now that we have all of the right people around the table, we need to think about communication with the broader community. I found what I think are some good resources for your reference. You'll find them on the CAPE website. The first comes from the University of Kansas. They have something called the Work Group for Community Health and Development. They created an online community toolbox. It is a very extensive collection of resources dealing with the topic of community development. I copied the section on communications to promote interest. That alone is 150 pages and is only one of dozens of topics covered. It covers most of what we might consider traditional communication tools. Later, I'll share other resources related to internet communication. I won't try to cover everything. It's for your self-study, but they do make a number of good points I'll touch on here. Effective public relations starts with a good plan. You want to be able to clearly articulate exactly what needs to be accomplished through your public relations campaign. What is your purpose? Who's your audience? What's the message you want to convey? How will you reach your target audience? They include a discussion of principles of persuasion I like. I've done many of these things intuitively. It would be better to do more of this purposely. Know your facts and your audience. Make a personal connection with the audience through some shared experience or concern. Where necessary, utilize opinion leaders influential with your target audience. When making a presentation, have a strong opening. Get to the point as quickly as you can. Point out the benefits and minimize the cost of what you are asking for as much as possible. You'll want to ask for clear, simple action steps. Have available alternatives ready. As much as possible, you are seeking to secure a commitment to doing something. Have models or examples of what you're asking for ready. When you have secured an agreement, repeat back the message and the actions everyone have agreed to undertake. Thank people for their cooperation. Finally, follow up and keep people informed about your effort. The guide covers a wide variety of the traditional communication tools and techniques. I'll let you look at it for yourself. What struck me when reading through this was that I thought I pretty much knew it all after 30 years, but I learned a lot, and I think you will too. I'll offer a bit about the use of social media. In today's day and age, we are increasingly using these types of tools to connect with people in groups. Having said that, I'm ill-equipped to offer very much insight. I feel like much of this has passed me by. Social networks are a pretty big deal. Globally, Facebook claims over 2.2 billion active users. You can see how these other platforms stack up. I don't even recognize many of them. And I think the numbers may be a bit exaggerated. For example, I created accounts on a couple of these platforms just to see what they were. I've never used them. But that's me. Many people, especially younger people, are heavy users of these tools. Here again, I was able to find several resources for you. They come from the Center for Disease Control. There are 3 guides to communicating health messages using social media. You'll find these on the CAPE website. The CDC guides walks you through the steps of building out a health communications campaign. It covers all of these platforms and includes best practices for use of each. It talks about how to use social media to build and connect community networks. This is the same notion I talked about when I earlier suggested having the high density of networks as being a characteristic of successful communities. So with that, we'll wrap up for now. Next, we'll begin a discussion of engaging the community and building community consensus about priorities and action to be taken. Here's how to get in touch. Thank you for watching.